Once again, we have the director of the HHS spreading misinformation. A person who's never gone to medical school, treated a patient, nor written a prescription, yet comes off as an expert in what it's like to run a medical practice. Let's see what he has to say.
You start prescribing this drug, and they'll incentivize the doctor in all kinds of ways to do that. And so the doctors also have their own incentives, perverse incentives.
I call this a 2-for-1 because not only does it erode the faith in our vaccination program, but it erodes the faith in believing that your physician is a truly caring person who has your best interests at heart. He talks about an incentive program and free lunches, and then the doctors making their own perverse requests. But let's see what that is. You see, big medical practices have very little time to learn about the newest medications. They can't be going to conferences because they're in the office all day. So the best time to educate a medical practice is during lunch. So drug reps often come in with lunches and sandwiches and discuss the latest medication with the physician and their staff. Now, if you think that's going to change the way a physician writes, you're sadly mistaken. If anyone regulates what a physician prescribes, it's the insurance company. That physician could hear this meeting at lunch and decide, I'm going to start writing for this drug immediately. And more than likely, the pharmacy is going to call them back and say, guess what? The insurance company won't pay for this latest and greatest. It's going to cost the patient $400. But they recommended this other drug, which is very similar, and that will cost them nothing but a copay. So it's the insurance company that's going to regulate what a doctor could write. And these perverse incentives, I don't know what they mean. Perverse incentives, what? Take them to a strip club and buy them a Porsche? In 40 years of practice, I never heard a single doctor making a perverse request.
There's a published article out there now that says that, and then there's a whole structure where Blue Cross and the other insurance companies pay bonuses to the pediatrician to make sure, if, for example, 95% of if their clients are fully vaccinated, they get a huge bonus. It could be tens of thousands of dollars.
Where did this come from? Well, once again, there's a study that he quotes from that just simply can't be found. But you can find a blog, and we know the blog is just one step below the New England Journal of Medicine when it comes to quality information. In 2016, titled, Your Doctor Does Not Have Your Best Interests at Heart. And in that blog, they extrapolated data from the Blue Cross Blue Shield system regarding incentives that were given to practices that had wellness programs. If a practice followed a good wellness program, which included diet and exercise, hypertension control, diabetes control, and of course, vaccines, and if they followed these best practice guidelines, they were rewarded with between $400 and $9,000 annually. And that wasn't per patient, that was for everything. So $40,000 came out of thin air. $9,000 is the most a practice was able to get. And it wasn't just for vaccines. It was for the whole ball of wax, making a complete wellness program.
There's a published article out there now that says that 50% of revenues to most pediatricians come from vaccines.
50% of a pediatric practice's income comes from giving vaccines? Let's look into that. In order to understand the finances of a vaccine program, you have to see how the vaccine gets to the office in the first place. It's usually purchased through a medical supply house. Now, here's a clip from a very reputable supply house in New York. I chose the MMR vaccine because it's very popular and well known. It costs over $3,000 to purchase 10 vials. And once you've purchased it, there are other costs involved. Some vaccines need climate control. Then there are administrative costs. And then there's waste management costs. When a vaccine is administered and that physician submits a bill to the insurance company, they're hoping to recoup the purchase price plus the administrative price plus some profit. Well, the American Academy of Pediatrics did a study, and they published it in the Journal of Pediatrics. And they found that more than 1/2 of the pediatric practices either broke even or lost money in their vaccination program. Especially if they were treating Medicaid patients, then it almost always was a loss. So no, they're not making a lot of money giving out vaccinations. It's certainly not counting for 50% of their income. And it's unfortunate that he's attacking pediatricians because they are on the lower end of income when it comes to physicians. And I think they should be on the higher end. It's a very stressful job. If you don't believe me, ask your pediatrician how they feel when a parent brings in a 6-month-old who says they're not acting right, they've got a runny nose and they've got 101 fever. That pediatrician's got to quickly decide, is this just a simple viral upper respiratory infection, or is this early meningitis? So it's a hard job. You're dealing with people who can't express what's bothering them.
Clients are fully vaccinated. They get huge bonuses. It could be tens of thousands of dollars. And that's why your pediatrician, if you say, I want to go slow on the vaccines or I want to have a little different schedule, your pediatrician will throw you out of his practice.
Getting thrown out of a pediatric practice. How does that even occur? Well, I can tell you it's not because you've questioned the doctor when it comes to giving you vaccines. Like he says, it's going to erode that big $9,000 they might get and they don't want to lose that money. No. It's threefold. Most physicians can't handle the financial burden of a modern medical practice. Between staffing, between coding regulations, between billers, between receivers, between malpractice premiums and everything else, they've given up their practices to corporations, which is why when you go to your doctor now, you might not see Dr. Jones MD on the shingle anymore. You might see so-and-so healthcare system because it's run by a corporation now, and that corporation is running it as a for-profit business. And they're going to tell that pediatrician to maintain profitability, you have to see 70 people a day. We're giving you 7 minutes for a well visit and 20 minutes for a complicated visit. And you start getting behind in that schedule, they know because it's all electronic now, you're going to start to get disincentives. They're going to start taking away the $9,000. So why would you get thrown out? Well, it's certainly not because they're afraid of losing their incentive. It's basically threefold. First of all, vaccines and vaccine schedules are carefully studied. And when a vaccine schedule comes out, it's based on reproducible results that give the best outcome and the most efficacy to that vaccine. So if you start altering that schedule and start increasing the duration between the initial vaccine and the booster vaccinations, in all likelihood, you're going to alter the efficacy of that vaccine. And that pediatrician's responsibility is towards their patient. So they're not going to want to alter that vaccine schedule because it opens up uncertainty as how effective that vaccine is going to be in the long run. Second, I explained the time constraints that are put on physicians these days. They no longer own their practice, they're employees. So if you have a parent who's haggling every little thing and they have no medical knowledge other than what they read on the internet, it's going to be very difficult to maintain your schedule with something like that. Therefore, it's more likely that they'll be relieved from the practice. And finally, medical legal reasons. If the doctor says, okay, we're not going to give the booster at 18 months, we're going to give it when he's 5 years old like you want, and that child catches that communicable disease and something horrible happens, and it'll end up in court, and I guarantee it will. They're going to say to the parent, you have medical training? Did you do a pediatric residency? How well do you understand these vaccines? Oh, you don't have anything. Well, doctor, you did a pediatric residency, you understand the vaccines? Well, you knew better. Why did you change the schedule? You're guilty of this. So, medical legal reasons are the third reason why a pediatrician might relieve you from the practice if you start constantly haggling about the vaccines. Now, it's good to ask questions. It's good to be knowledgeable. However, to try to override a physician who has all the knowledge and understanding from studies that are reproducible, that's when it becomes a negative influence. I hope that you learned something in this video. You have a little bit more faith in our vaccine program and understand that doctors are not getting tens of thousands of dollars for writing prescriptions. And in fact, those prescriptions are really going to be regulated by an insurance company. Then I wouldn't mind if you click the bell, hit subscribe for future videos, and I'll catch you at the next video. Take care, have a good day.